they're not 21-year-olds in the same way as happens with more traditional degrees.
So do they need to be better informed before they even apply for the course, so that their expectations are not set incorrectly?
No, I think it is absolutely reasonable for anyone going into a registered nursing programme to expect to be able to get a job. We know that there is real need, expectation and requirement for nursing and for healthcare is increasing exponentially. What we need to do is remove the barriers that are stopping people getting the jobs that need to be done.
No fewer than 107 universities give out nursing degrees in the UK. Last year, more than 18,000 people accepted a place on one of those courses. But are many of them actually wasting their time? The Royal College of Nursing says that many nursing graduates are struggling to get a job when they finish. The RCN says the problem is that the jobs advertised tend to require experience, which rules out new graduates. Patricia Marquis is the Executive Director of the Royal College of Nursing in England. Patricia, good morning.
Good morning.
Can you explain then why, or what an entry-level role is for a registered nurse, first of all? How should this system work?
So the entry-level roles are the bottom pay band for those who are registered nurses, and it's a role where really you should be just consolidating what you've learned as a student, and once you're graduated, you then really are practicing your trade. You should have a level of support and just be developing the skills to be actually taking charge, making decisions about patient care, etc. So they are, it's a very specific starter role that should be open to every single new graduate. But what's happening is that organisations are putting requirements in, asking for people to have 6 months up to 2 years experience or qualifications that you can only get once you've actually graduated as a baseline nurse.
So I suppose the question here, Patricia, is where the problem is, because one argument in favour of how these places are recruiting is that those roles, those kind of entry-level roles, no longer exist, they are no longer required, that actually the threshold has to be higher. That's the sort of people they need in those workplaces. So is it just that there is less need for entry-level nurses?
Well, that's a whole other argument, and there is currently a huge piece of work going on to reassess actually all of those entry-level roles, because there has definitely been skills drift where people who are now still being paid at that entry level actually are required to have and do need to have skills beyond that. But it is absolutely clear that there will always be a need for people to learn to be a nurse. Once they've graduated, you don't leave university the fully formed, nurse. You do need to have an opportunity to work supervised. And there are things that people will do through those first couple of years of their postgraduate time in the workforce to start to develop the skills, the confidence to be a safety critical professional, make decisions that are going to affect people's lives every single day.
Perhaps as well, Patricia, there's a question about whether the courses are teaching the right things. Do the courses need to evolve?
Well, again, we do think that there does need to be some tweaks to the way nurses are educated, but there is no way you're ever going to come out fully formed as a new graduate. That's not what's intended. Nursing is a lifelong career. It's a brilliant career, and the options are endless. And I would still absolutely encourage anybody who's thinking about it right now to go into it. But you have to learn the skills, and you can't be learning those whilst you're a student, because you can't be left to make decisions about patient care. You can't be left in charge of shifts or in charge of huge caseloads when you don't have the skills to do it. So there has to be that period of transition between learning to be a nurse in university and actually being a registered nurse in the workforce.
Yeah. I suppose the other part of it then is how to kind of bridge all of these gaps that we're identifying in the system, even as our conversation goes along here. For example, do nurses need to be more willing to move around the country to get their first job, because needs in different places will differ?
Yeah, and we can see that it is tougher to find a job in certain areas of the country and certain specialties, mental health and children, etc. In different places. It's not easy anywhere. There is still a very tight market in every place, and yes, students should be willing to move around, graduates, but nursing students are often not quite the same as other graduates in that many of them are more mature, many of them have other commitments such as, houses or children that make it much more difficult for them to move around. But we are calling on the government to support people who are able to move, to be able to make that move by offering, for example, relocation packages that make it smoother for them to be able to make that move, or for organisations in areas that are struggling to recruit to offer golden hellos to be able to tempt people and with perhaps a travel card, for example, to be able to, again, to make those moves. But it's not quite as straightforward as just saying move around. We know there are jobs in other sectors too, in social care, for example, and in a huge range of other organisations that nurses work. But actually going into those areas requires those areas to offer packages of support to enable students to make the transition.
Yeah.
So
I do find that argument interesting, Patricia. I get that. I suppose, there are countless examples in other professions of people who will go to university in one city, immediately move to a different city because that's where they can get their first job. Within a couple of years, they may be on to somewhere else. And none of that comes with golden hellos or relocation packages or anything. There is just a kind of acceptance that people move where the demand is, and as they kind of escalate, I suppose, through their careers and progress through their careers, that might require relocation.
Yeah, but as I say, a lot of nursing graduates they're not 21-year-olds in the same way as happens with more traditional degrees.
So do they need to be better informed before they even apply for the course so that their expectations are not set incorrectly?
No, I think it is absolutely reasonable for anyone going into a registered nursing programme to expect to be able to get a job. We know that there is real need, expectation and requirement for nursing and for healthcare is increasing exponentially. What we need to do is remove the barriers that are stopping people getting the jobs that need to be done. So no, we would say absolutely at the moment there are barriers being put in place that are unnecessary and are making it more difficult than is needed for new graduate nurses to get into the workplace. We need every single one of those. What we don't want is for people who can't move, for example, to start to go and get jobs in other sectors, because getting them back into healthcare will be impossible. And what we've got is a cycle of boom and bust. This happens periodically because our workforce planning system just is broken and does not work. You will recall that in recent years, the government's plan was to fill all the gaps we had by recruiting overseas, often from the south of the globe, taking nurses away from other countries who well need them themselves. So we've gone through a period of needing to recruit overseas, and now we're in a period where our own graduates are struggling to get jobs. It's complete madness. The whole system needs fixing. But what is clear is there is work for every single one of these new graduates, and there needs to be things put in place to enable them to access those jobs.
Patricia, can I just ask you, a lot of our listeners are getting in touch while you're speaking, and they're all reflecting the same question, really, which is why is it necessary for nurses to be trained in this way? Many people saying, would it not be better to have a practical course? Would it not be better to have an element of work experience? Would it not be better to train as apprentices? Is it time to rethink the way that we are doing this?
So first of all, there are already apprenticeships, so you can do registered nursing apprenticeships, and so that exists already. When students are at university doing a traditional course, they do 50% of their time in education and 50% of their time on the job. And that's a source of frustration for many, because when they're on the job, they are treated as if they are part of the workforce. but they are paying for the privilege of doing this. Nursing is a highly skilled, professional, safety critical job. It is not just people who are in it to care because out of the goodness of their hearts. This is a really serious role that needs expert, high-level education. It is, you know, personally, as a registered nurse, it's an insult to me to say to me that what we do as registered professionals just needs a bit of on-the-job training. It is way beyond that, and anyone who has experienced healthcare in recent years knows exactly how skilled and how expert nurses need to be to provide patients with safe, skilled and critical care.
Patricia, it's good to speak to you. Thanks very much. Thanks for joining us.
Thank you.
That's Patricia Marquis, who's the Executive Director of the Royal College of Nursing in England.